But what you saying, Jimmy? Me saying a hot minute, you know.
We're going to say that it's been a hot minute for real. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out there for a little bit, but still I just have some fun though.
Well, my say can't leave the house unless I'm vaccinated.
But you won't scared of the vaccine?
Nah, sis, the vaccine's safe.
VI people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better, not worse.
I want a COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe.
Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated.
I want a COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe.
Brought to you by the Virgin Islands Department of Health MCH program.
Okay, great. Thank you.
Hey, you.
Hey, babe. Thanks for lunch.
You're welcome. Who is that?
That was a representative from the Virgin Islands Department of Health. They're doing a survey called BRFSS.
Oh, for what?
It's to address chronic diseases facing the Virgin Islands. Diabetes, heart and kidney disease, cancer, stroke, and more.
What kind of questions do they ask?
They ask questions about food, exercise, age, smoking, and some others.
Is that all they ask? Do they ask questions about...
Security? No. They don't ask anything about Social Security, money, or credit card information. The information that they do collect is used to guide public health programs that affect all of us. You, me, the kids, the community,
and the entire Virgin Islands.
Oh, okay. Very interesting. I'm glad we could do our part to help.
Yes, we've got to do our part.
For more information, visit our website or call John Orr at 340-643-5422.
When you're deaf or hard of hearing, operating a vehicle presents a unique set of challenges. If you're pulled over by the police, please follow these directions. Using your left hand, hold your communication accommodation visor card outside the driver's window in plain sight for the officer to see. Indicate to the officer the best way to communicate with you. The officer will then use this method to alert you for the reason of your traffic stop and what you need to provide. Be sure to follow all the officer's instructions to ensure a safe and calm interaction. To obtain a communication accommodation visor card for drivers who are deaf or hard of hearing, please contact the Virgin Islands Bureau of Motor Vehicles at 774-4268 on St. Thomas, 713-4268 on St. Croix, or 776-6262 on St. John.
Sponsored by the Disability Rights Center of the Virgin Islands.
Virgin Islands veterans, I'm standing here on Veterans Drive, built in honor of us, Virgin Islands veterans. But we now must do our part to bring more VA medical benefits to our shores. How can we do that, you may ask? Get on www.va.gov and get registered. This is the way that we can do our part. Get registered at www.va.gov. We're counting on you.
Good day. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of October 18th, 2021. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. I am joined this afternoon by Dr. Ty Hunt Caesar, who is here on behalf of Health Commissioner Hussein Canasio to share the latest COVID-19 data and information on where Virgin Islands residents can get a free COVID-19 test and vaccine this week. But before I go to Dr. Hunt Caesar, I want to take this opportunity this afternoon to extend condolences on behalf of Governor Bryan and Lieutenant Governor Roach to the family, friends, and many colleagues of the late General Colin Powell, who passed away after complications from COVID-19. Powell was a respected U.S. military leader and pioneer, having served as the first African-American U.S. Secretary of State and the first African-American to serve as the National Security Advisor to a U.S. president. As a prominent West Indian American, his achievements were an inspiration to people of African descent throughout the region and the nation. Unfortunately, his passing is yet another sobering reminder that the COVID-19 crisis is not quite behind us and is still very, very real. May his soul rest in peace. Dr. Ty Hunt Caesar.
Good afternoon, and thank you, Director Mota. As of October 16, 2021, a total of 191,254 tests have been conducted in the territory. Of those tests, 7,074 individuals have tested positive. The 7-day positivity rate is 3.54%. There are currently 179 active cases in the territory, of which there are 149 on St. Croix, 29 on St. Thomas, and 1 on the island of St. John. 6,817 cases have recovered, and unfortunately, there have been 78 fatalities. Of the 78 individuals who have died due to COVID-19 complications, 54 have died since the COVID-19 vaccine has been available in the territory. Of those 54 individuals, only 1 was fully vaccinated. 3 men in their 30s have died on St. Croix recently due to COVID-19 complications. On behalf of the Health Commissioner and Department of Health, I'd like to extend condolences to all affected by COVID-19 losses across the territory. A vaccine is available for everyone ages 12 and up, and I encourage adults and children who are eligible for the vaccine to get vaccinated. This includes parents encouraging their children to get the vaccine. We must protect the younger, vulnerable members of the community. Please make the right decision to become vaccinated, especially to protect those ages 11 and younger who are not yet eligible. They are depending on us. We are now seeing the nationwide trend of the pediatric infant population hospitalized for COVID-19 complications. This is a critical concern because the territory does not have pediatric intensivist specialty services. Additional doses of Pfizer and Moderna are approved to complete a 3-dose series in a small population, while Pfizer booster doses are approved for anyone 18 years and older who identifies as a high risk of exposure given at least 6 months after receiving the 2nd dose. Moderna and Janssen booster doses, although approved recently by the FDA, is not yet authorized in the territory because the Advisory Committee on Immunization Practices and the Centers for Disease Control and Prevention must first endorse this recommendation. Protect our beautiful environment, vital for our fishery and tourism industries and local pride. If using a disposable mask, dispose of it properly. The roadside parking lots, hiking trails, beaches, or anywhere outside of a trash or garbage receptacle are not appropriate places for dumping used facial masks. If you are sick or have been exposed to someone with COVID-19, please call the epidemiology hotline to schedule an appointment for a test. The hotline is open 7 days a week, or schedule an appointment online at covid19usvi.com/testing. From our hospitals, the Governor Juan F. Louis Hospital and Medical Center reported 2 COVID-19 admissions and 1 patient ventilated, and the SRMC, Schneider Regional Medical Center, reported 1 COVID-19 admission with no patients ventilated. Monoclonal antibody treatments are steadily picking up in the island of St. Croix, thankfully. You are encouraged to accept this treatment early when the treatment team contacts you. Early intervention is crucial, and even more crucial to get your vaccine 90 days later. Otherwise, if you recovered from COVID-19 without monoclonal antibody treatment, you can get the COVID-19 vaccine as soon as you're out of quarantine. This is vital to prevent reinfection or infection with other variants and have worse complications. To get vaccinated, please call the scheduling hotline, walk in, or schedule online. Homebound patients can also be scheduled online or via the hotline with the support of our mobile strike team. Thank you, MST. The current schedule for our pop-up vaccinations can be found on our websites. They are currently occurring on Tuesdays and Thursdays at the Charles Harwood Complex on St. Croix, Tuesdays and Thursdays in St. Thomas at Cost-U-Less, and Wednesdays in St. John at the Port Authority Gravel Lot. The St. John location also has free COVID-19 testing side-by-side with vaccination offering. Vaccines are also provided on a recurrent basis at the market in St. Croix on Wednesdays and the farmers market at the agricultural fairgrounds on Central Line Road on Saturdays. Also available on a recurring basis in St. Thomas, vaccines will be given out at the market every Monday in October from 10 a.m. to 1 p.m. The $250 gift card incentive program distribution continues from Monday through Friday from 9 a.m. to 3 p.m. on St. Croix and St. Thomas at the community vaccination centers, and between 10 a.m. to 3 p.m. at the Morris DeCastro Clinic on St. John. Please bring your vaccine card or digital vaccination record and a valid picture ID. To keep up with the latest information, including updated information on the COVID-19 epidemiology and vaccine data, or anything else, please visit the USVI Department of Health Facebook page or visit at www.covid19usvi.com. For COVID health information alerts, text COVID-19 USVI to 888-777. Thank you.
Thank you, Dr. Ty Hunt Caesar. And I extend my condolences on behalf of Governor Bryan and Lieutenant Governor Roach to the families and loved ones of those individuals who passed away from complications of COVID-19, and pray for a safe and speedy recovery to all those who are currently hospitalized. We continue to urge residents on St. Croix in particular to take extra precautions as the virus is still surging acutely on this island. In other COVID-related news, the Virgin Islands Department of Human Services issued the Summer Pandemic Electronic Benefit Transfer, otherwise known as Summer EBT, to eligible to students in grades K through 12 that were enrolled in USVI public and private schools for the school year 2020 through 2021, and and also those schools who participated in the National School Lunch Program. For eligible children who currently receive SNAP, the benefits will be loaded on the household's existing EBT card. For eligible children who do not receive SNAP but were issued a card for PEBT 1, 2, and 3, the fourth will be automatically loaded to those cards. For new eligible non-SNAP children, cards will be mailed to the addresses provided by parents and guardians and will be issued in the student's name. Households with more than one eligible student will receive multiple cards. Will be provided on, and you will also be provided on how to set up and utilize the cards to access those benefits. There is no application process. The Virgin Islands Department of Education and eligible private schools provided DHS with the names of those students enrolled for the 2021 or 2020-2021 school year. So there is nothing required from the parents. There's no application process. The information has already been shared with the Department of Human Services. PEBT benefits are not transferable. You must destroy the card if you do not want the benefits. This summer PEBT issuance is only for school-age children eligible who were age 6, who are age 6, who are identified in the child care category, and those children will receive their summer PEBT issuance by or before October 31st, 2021. So by the end of the month, you should receive those benefits. And it is a standard one-time benefit of $438 per child that will be issued. So for more information about this PEBT program, visit the DHS website at www.dhs.gov.vi, or for you may also call 340-772-7120 or email pebt@dhs.vi.gov with the subject PEBT in the subject line of that email. In closing this afternoon, we have some exciting non-COVID related updates. I am excited to announce today that the administration's plan for the revitalization of the town of Frederiksted is in full effect. We will be breaking ground on the much anticipated project to rebuild a new and improved Vincent Mason pool tomorrow at 10 a.m. We are inviting you to participate virtually and hear of the wonderful things in store for this new and improved community facility, as well as the other planned improvements currently underway in the town of Frederiksted. That presentation will be broadcast live on our Facebook page, which is facebook.com/governmenthouseUSVI, and on the Government Access Channel, which is Channel 27, if you have VIA. Speaking of planned improvements in the town of Frederiksted, I am happy to report today that the many months of work with FEMA we have been able to recommence the work on the Polly Joseph Stadium now that FEMA has approved a conditional letter of map revision that has stalled the project since last August. As an administration, we are particularly proud to be moving this project along from proposed to underway. In addition, work is underway to resurface and repave the roads in the town of Frederiksted, and we are asking the community for their patience and cooperation. While the crews make their way throughout the town, we ask that motorists remove their vehicles to allow for the paving of the streets. These projects, in addition to scheduled lighting improvements on Prince Street, the rebuilding of the Midre Cummins Park, and improvements to the Ann Abramson Pier are part of Governor Bryant's commitment to rebuilding the town of Frederiksted and improving the quality of life for its residents. Again, we are asking for the residents' cooperation as this work will cause some detours and other traffic delays. Lastly, in some other non-COVID related news that is related to capital infrastructure investments in the territory, I am pleased to announce that the territory that we will begin the replacement of the lights on the Melvin Evans Highway from Sunny Isles intersection to Hannah's Rest. That project is the result of a $1.5 million proposed appropriation by Governor Bryant that the 34th legislature recently approved. We are asking motorists again to take caution as they see road crews making these repairs in the coming weeks. So be on the lookout. We will be replacing all of the street lights from the Sunny Isles intersection all the way to Hannah's Rest, or the intersection between Melvin Evans Highway and Emancipation Drive. So please, when you see those workers out there, please take particular caution on the road. I will take any questions from the media, if there are any, and we have Ms. Suzanne Ellis from the VI Source with us. Thank you for joining us, Suzanne.
Hi, good afternoon. Thank you. I do have a few questions. And Doctor, can you tell us any updated numbers on how many residents have been vaccinated at this point?
Yes, I can. Let me just pull it up for you. Okay. Okay. Okay, so of the eligible population, we have, so small, here we go, 48,056 individuals who are fully vaccinated. That's 53.76% of the eligible population, and that is at least 12 years and over. And for those who have at least received one dose, that is 54,950 or 61.47%.
Great. Did you say 40,000 or 48,000?
48,056.
Thank you.
You're welcome.
The next question I have is, any ideas why St. Croix is spiking still?
Sure. It's primarily community transmission. So once you have cluster of individuals that that we're seeing, it's very difficult to mitigate community transmission because it's all over the place. So unfortunately, unless you have individuals who are really adhering to social distancing and quarantining, then you're just going to have continuous pockets of spread in the community. So the travel in the territory continues, but we've seen trends like this before in the different districts, and then it takes about 6 or 8 weeks or so for it to come back down. And then you'll see that it would, it might pick up in another district. So those are the trends that we've been seeing. But unfortunately, you really can't say why when it's widespread community spread.
Interesting.
And moreover, we don't have a very high percentage of vaccination that would actually allow us to have community immunity.
Thank you. And then the other question, can you walk us through your treatment for COVID? For instance, when somebody comes in and they test positive, what symptoms do you look at before you suggest monoclonal antibodies? And at what point, and then the people that you don't suggest that to, what do you recommend that they do?
Sure, that's a great question. So monoclonal antibodies are offered under the authorization, an emergency use authorization. And there is a treatment inclusion criteria and an exclusion criteria. The inclusion criteria is very wide, but the emergency use authorization is clear that we offer monoclonal antibodies to individuals who are at higher risk of progressing to advanced disease if you test positive and have developed symptoms within 10 days. Meaning that if you test positive and you have symptoms, we offer you the monoclonal antibodies within 10 days of you actually starting to have symptoms, okay? So you have to test positive and you have to be symptomatic. Some people who don't have any symptoms, they fall out of eligibility for receiving monoclonal antibody. And a symptom is something, it could be something as small as a mild cough, a fever, feeling tired, weakness, or it could be, the gamut where you have diarrhea, you just feel really, really awful. But if you have one qualifying symptom, then we would offer it to you. Now, the emergency use authorization has also expanded to actually treat individuals who are exposed but have not yet developed symptoms or tested positive. So that's what we call post-exposure prophylaxis. So in other words, for example, if we call someone at a home and they tested positive, we want to treat them, and we find out that they have elderly parents at home who live with them. They don't have symptoms yet, but they just tested positive yesterday. We would, instead of waiting until they develop symptoms or asking them to test, we would recommend that they be treated. And under the emergency use authorization, we can do that.
Okay, great. And that treatment is through an IV?
It's through an IV primarily. We have 3 monoclonal antibodies that are approved. One of them can be given subcutaneously, which is just an injection under the skin, or like very, very superficial, not intramuscularly. And that treatment is equal in efficacy, but the emergency use authorization prohibits us from using it unless there is going to be a treatment delay. So in certain instances, we have used subcutaneous treatments so that we can increase our throughput. We can treat individuals who perhaps maybe cannot make it to our treatment centers if we actually go to their homes and give it to them. So there are instances where we do use the subcutaneous form with one of the medicines, but all three primarily are supposed to be used as an IV dose, and we've had very good success with both treatments.
That's great. And what about people that don't have the symptoms but they've tested positive? What do you tell them to do?
So we watch and wait. So we monitor them. Because the emergency use authorization and from the federal programs, right? It is very clear that you need to have symptoms. And the reason why that's important is because sometimes you can test PCR positive very long after you've received, you actually were exposed to the virus. And if you don't have any symptoms, we really can't date exactly when you were exposed. And the way that monoclonal antibodies work is it's preventative. It actually blocks, the antibodies actually block the development and replication of the virus. So once you have a significant viral load replication in your body, these antibodies don't work anymore. That's why after 10 days, it's not efficacious and it's not authorized to use. So that's why we need to have some symptoms to date the onset of the infection. And if you just test positive, if you have an asymptomatic infection, you could have been exposed 3 months earlier, and the monoclonal antibodies would not have been effective. That's the reasoning behind it.
Okay, great. Thank you. That's great information to have.
My pleasure.
That's all.
Thank you, Suzanne. We have a couple of reporters who have joined us virtually this afternoon. I will first call on Lasiba Knight from the St. Croix Avis. Go ahead, Lasiba. Lasiba, if you can hear us, go ahead. Okay, in the interest of time, we also have another reporter who is joining us virtually, so I will move on to that reporter. I believe that is Sarah Kirkpatrick from the Virgin Islands Daily News. Sarah, go ahead.
Hi, good afternoon.
Good afternoon.
My first question is for the Dr. Ty Hunt. I had a question. The health department had previously talked on some vaccination rates specific to age group, and I was wondering if we had any more information on those rates per age group, and then maybe specifically on like the younger age group in the territory.
Specifically the age groups for the younger population, I do not. I will get that information to you afterwards shortly. I can get that, but I do have some information on certain. I have the ages 12 and up, I have ages 18 and up, I have ages 65 and up, and then of the total population. Are you interested in any of those, or are you just specifically interested in the children?
Oh no, like the 12 and up would, in the 18 and up is what I'm thinking.
So for the numbers for the fully vaccinated ages 12 and up are 48,056. And for the ages 18 and up, the fully vaccinated is 45,793. For ages 65 and up, fully vaccinated is 13,584. And of the total population, fully vaccinated is 48,084. And those are fully vaccinated. So that includes the individuals who have received at least 2 doses of Pfizer and Moderna and 1 dose of the Janssen vaccine.
Great, thank you. And then my next question is in regards to the travel portal. I know right now we have the virtual vaccine card, but currently it seems that that's not valid for reentry by itself. You still have to go through the travel portal. So I was wondering if we had any progress or updates on just being able to use the virtual vaccine card for like resident reentry.
So unfortunately, no, and that's not something we are actually working on. It's actually very important that you complete the travel portal. It's not only important to produce a vaccine card, it's actually very important to ensure that you're not exhibiting symptoms and actually have been exposed to someone else who has tested positive for COVID. So the travel portal actually allows us to capture all of the information that's necessary, and we're not just interested in if you've been vaccinated, because even if you've been vaccinated, you still potentially have some sort of exposure or public health related threat without actually answering all of the questions honestly.
Okay, great. Thank you for clarifying on that.
My pleasure.
Thank you, Sarah. We'll go back to Lasiba Knight from the St. Croix Avis. Lasiba, are you with us? Lasiba, go ahead. Okay, unfortunately, we may be having some issues with connecting with that reporter. So I think that would be all for questions today. Remember, please wear your mask, continue to practice social distancing, and please get the vaccine now that it is available. Thank you for joining us today for this Monday's weekly press briefing and COVID-19 update. We will see you next Monday. Thank you.